Good afternoon, and thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi, and as always, on Tuesdays, we've got a special guest to discuss COVID-19 specifically in the Hispanic community here in Colorado. And as always, we are chatting today with Dr. Ricardo Gonzalez Fisher, a medical expert with Servicios de la Raza. And if you have a question in either English or in Spanish, we'll be doing this bilingually. Make sure that you email me at chris.bianchi@9news.com. We'll make sure that your question is answered either this week or more likely in the upcoming week. Doctor, can we start things off by asking you about this Omicron specific vaccine and why it'll be important to potentially to get it when it's available in the next few weeks?
Yes, it's very important to talk about this, Chris, because as we've been witnessing during the past months, we've had new variants and sub-variants of the original coronavirus, the COVID-19 virus. And we've been seeing that certain variants are being more resistant to the vaccine. And this means that even if we're vaccinated, we can get COVID-19. One of the things we have to remind our viewers is that even if you get COVID-19 when you're vaccinated, you have a lower chance of getting severe COVID-19, going to the hospital, or even death. So the vaccines are effective and they're safe. But with the new covariants, the BA4 and the BA5 of Omicron, a lot of people who are vaccinated are still getting infected. So the idea is if we get a vaccine that will also prevent infection for Omicron, we'll have a lower rate of infections in the future.
Doctor, when do we expect this vaccine or booster, whatever you want to call it here, when do we expect it to become available?
We were waiting for it to come in October, but a couple of days ago, there was a notification from the White House that perhaps we're going to be able to be using it in September. So this is a very, very good news. So just as soon as we have it, we will let everyone know.
So coming up in the next few weeks. And of course, another big theme, doctors, a lot of kids go back to school this week here in Colorado and across the country. How could that affect COVID numbers, and how should we see the virus from that lens?
This is the third year that we have a back to school for children after the beginning of the pandemic. This is the third back to school event. And this time in our state, schools are going to be open and they're going to be in person. What is interesting is that now that we're living in a different stage, that we're thinking of COVID as an endemic disease, a lot of the precautions that we were using to prevent the transmission or to mitigate the spread are being lifted. So now kids do not have to wear a face mask in class. They're taking away the 6 feet separation between kids. And but although vaccines are suggested, they're not mandatory. So what we're going to see is an increase in cases coming after the beginning of school, because kids are going to start to spread it among them and maybe bring it to home. So we need to be very careful with this.
So what additional advice might you have for parents and for kids as they go back to school?
There's 2 or 3 things that we can still do. I mean, kids are kids and they're always going to be kids. And I agree, they need to be happy and enjoy their back to school. But if we have symptoms, we need to test them and stay at home. If one of our children is with someone who's infected, then it would be a better idea to have them home until this is over and not send them to school because they can spread the disease. And of course, I'm never going to stop promoting the vaccine. So I think it's a very good idea to start, if you haven't got your children vaccinated, start getting the vaccine, because now, because of all of these control measures being dissipated, we're going to start to have more cases.
Speaking of the vaccine, can you tell us about some of those vaccine clinics that you and Servicios de la Raza are organizing, please?
We will be at the Mexican consulate, 5350 Leedsdale on Thursday from 9 to 1. You don't have to be Mexican, or you don't have to have any business in the consulate. Just go there and get a vaccine if you want to. We'll be there, no problem. The other one, we're going to be at Servicios de la Raza on Thursday from 4 to 8. They're requesting appointments there, but people are invited to go there. We're at 3131 West 14th Avenue, close to Colfax and Federal. So if someone wants to go there later hours, just call and we'll be there for you. And finally, we'll be on Thornton on a back to school event on Saturday.
So a couple of great options. And once more, thanks again for joining us here. Dr. Ricardo Gonzalez Fisher with Servicios de la Raza. We appreciate a few minutes of your time today. And we'll, of course, have continued updates in the coming weeks about how COVID-19 is specifically affecting and impacting the Hispanic community here in the state of Colorado. So, Doctor, once again, thanks for joining us today. And we'll see you right back here next week.